When cells are exposed to a new environmental stimulus, they can adapt in four main ways: hyperplasia, hypertrophy, atrophy, and metaplasia. Hyperplasia is an increase in cell number. This adaptation occurs in cell types that can replicate, such as endometrial epithelial cells. During the follicular phase of the menstrual cycle, increased estrogen causes endometrial epithelial proliferation. However, prolonged excessive estrogen results in endometrial hyperplasia. This can lead to uterine bleeding and increased risk of endometrial carcinoma. Hypertrophy is an increase in cell size. This adaptation is crucial in cells that cannot replicate, such as cardiomyocytes. In response to increased workload, such as hypertension, cardiomyocytes enlarge by increasing protein production. This increases the cardiomyocytes' contractile strength to adapt to higher demands and results in enlargement of the heart. However, hypertrophied cardiomyocytes are vulnerable to ischemia-related cardiac dysfunction. Atrophy is a decrease in cell size. This adaptation can occur in many cell types as a result of decreased tissue use, nutrient or oxygen availability, and hormonal or neurologic stimulation. In response to decreased workload, skeletal myocytes reduce metabolic requirements by decreasing protein production and increasing protein breakdown, leading to smaller cell size. However, prolonged disuse can lead to myocyte apoptosis. Metaplasia is replacement of one differentiated cell type with another that is better equipped to tolerate the environmental stressor. In response to cigarette smoke, ciliated respiratory columnar cells are replaced with squamous cells that are more resistant to the toxin. However, this change in phenotype increases the risk of respiratory infections, and chronic toxin exposure may predispose to squamous cell carcinoma. Cells can adapt in a variety of ways to an environmental stimulus in order to maintain function. These adaptations are reversible once the stimulus is removed. If the stimulus overcomes the cell's ability to adapt, it can be injured and undergo cell death.